Good afternoon, everyone. Bon après-midi à tous. Today, there are 454 new cases of COVID-19 in Ontario. There are 243 people in hospital and 136 in our intensive care units due to COVID-related critical illness. And I am sorry to say that about another 9 deaths have been reported. A total of 33,364 tests were processed yesterday with a positivity rate of 1.8%. As far back as July, I spoke about an anticipated rise in cases as we move towards the fall and winter. We are now seeing this occur in some parts of Ontario. As the temperature begins to drop and more people move indoors, we can expect to see cases fluctuate or continue to increase over the coming months. While this is not cause for alarm, it will require continued vigilance from each of us, and we must stay cautious and disciplined in the face of this virus. Provided we follow public health measures and increase our vaccination rates, we can continue to manage transmission of the virus at a local level and minimize the impact on our hospitals and intensive care units. Tant que nous respectons les mesures de santé publique et que les taux de vaccination augmenteront, nous pourrons continuer à gérer la transmission du virus au niveau local et minimiser les impacts sur nos hôpitaux et nos unités de soins intensif. The transmission we are currently seeing is predominantly among the younger age groups and the unvaccinated. And while the younger age groups are typically less likely to suffer severe outcomes from COVID-19, the virus still has the potential to cause serious illness and hospitalization. If someone is infected, even with mild symptoms, they can still transmit the virus to others who may become more vulnerable. This virus is not going away. There's no way of escaping it. So if you are not vaccinated, you are susceptible and at increased risk of serious illness and significant outcomes associated with COVID-19. We have safe and effective vaccines to protect yourself, your community, and your loved ones. And getting vaccinated will help us to recover much more quickly as a population by having the highest immunization rate we can achieve as a province. And if you are just starting your vaccine series, the National Advisory Committee on Immunization recommends an optimal interval of 8 weeks between first and second doses of a 2-dose COVID-19 vaccine series. Individuals who wish to get their second dose at a shorter interval, as applicable, can continue to do so, but with informed consent. And I want to say thank you to everyone who has been vaccinated. Currently, 88.5% of eligible Ontarians have 1 dose, and 85.2% have 2 doses of a COVID-19 vaccine. In regards to booster doses, I also want to thank the eligible Ontarians who have already come forward to increase their protection against COVID-19 by receiving their 3rd dose or booster dose. While a primary series of COVID-19 vaccine has shown to maintain high vaccine effectiveness and is providing powerful and persistent protection following the 2nd dose, emerging evidence suggests vaccine effectiveness against symptomatic infection and mild illness may decrease over time, and a booster dose could help restore and maintain the protection against infection. Particularly important are 3rd doses for individuals who are immunocompromised, such as transplant recipients, cancer patients, and individuals taking immunosuppressant medications. A 3rd dose completes their series to provide the best possible protection. With cases increasing and more of the virus circulating, I am strongly encouraging the many eligible Ontarians who have yet received their booster dose to consider doing so to ensure they get that extra layer of protection against COVID-19, including the Delta variant, as we head indoors. Le nombre de cas étant et la hausse et plus de virus étant en circulation, j'encourage fortement les nombres ontariens et ontariennes admissibles qui ne l'ont pas encore fait de recevoir leur dose de rappel bientôt pour s'assurer de bénéficier d'une protection supplémentaire contre la COVID-19, incluant le variant Delta. And because Ontario is seeing an increase in some of its key indicators, including the effective reproductive number, the percent of tests that are positive, and our weekly case rates, and out of an abundance of caution, we are pausing the next step of the plan to reopen Ontario and manage COVID-19 for the long term. This means that the planned lifting of capacity limits in remaining settings where proof of vaccination is required will not be moving ahead on November 15th. Et parce que certains des indicateurs clés de l'Ontario sont à la hausse, y compris le taux de reproduction nette, le pourcentage de tests positifs et le haut hebdomadaire de cas, nous interrompons l'étape suivante du plan pour un déconfinement prudent en Ontario et le contrôle à long terme de la COVID-19 par excès de prudence. Cela signifie que la levée des limites de capacité dans les environnements qui restaient où une preuve de vaccination était requise ne se fera pas tel que prévu le 15 novembre. We will remain vigilant and continue to monitor trends, and we will evaluate in 28 days if it is safe to move forward. We have taken a cautious approach to reopening the province, and the plan was always designed to be guided by the ongoing assessment and monitoring of key public health and healthcare indicators to ensure that public health and workplace safety measures are lifted safely. Ontario has continued to make progress as a result of its safe and cautious approach to reopening. We continue to have one of the lowest weekly case rates in the country, and our hospital intensive care capacity is currently stable. But to ensure that we maintain our progress, it is necessary to make this deliberate pause. We must remain vigilant. And we must continue with key public health strategies that have been effective in keeping this pandemic under control. Continue to stay home when sick. Get tested if you have symptoms. Wash your hands. Wear a mask. And above all, please get vaccinated. Thank you. Merci.